Hi, I'm Andrew Palmer from Cambridge Deaf Association. Welcome to Fincham House building in Cambridge. We've got a special guest here today. We've got Dr Tamsin Holland-Brown, who's a paediatrician, who's been undertaking some great work to support children from the global south, really, to improve their hearing, and is here to tell us about her career as well. So, Doctor, thank you for joining us.
Thank you so much. Yeah, it's lovely to be here. Thanks.
So before we get into the really interesting thing about what's in this little box, let's just talk a bit about you and your career and what led you into working with kids, and also what got you into being like an inventor, I guess.
Yeah, I trained as a paediatrician and then was busy just doing paediatrics and doing my general paediatric clinics. And then at some point I was asked to take over some of the audiology clinics, which was, from a medical point of view, was more about thinking about why children were deaf and how it impacts them and what we can do to support children so that it doesn't affect their development or doesn't affect how they access education. So I had more of a holistic developmental look at children, and also maybe doing some tests sometimes to try and work out what was making them, affecting their hearing. And I think that over a long period of time, like decades, it's not as if I was very quick at this, but over a couple of decades, I was seeing that there was a pattern of some children who had a kind of mild to moderate hearing loss that was fluctuating, that people didn't worry about so much. Some of those kids would end up back in my paediatric clinics, and people would be worrying about their development and their speech and language skills and whether they had good attention, or whether I needed to investigate them for attention deficit and hyperactivity, or even things like autism or social communication difficulties. And for some of them, you would see a background of having glue ear, which is where children just get very congested after coughs and colds and ear infections. And they get this congestion that sits behind their eardrum, makes it difficult for them to hear well.
So why is it that the children get this congestion and adults don't? Because we all know maybe the feeling of congestion in the ears, but it seems to sort itself out. So what's the difference with kids?
Yeah, you're quite right. We do get it, you're absolutely right, but it's kind of should last for a couple of days. If we've got a really heavy cold, you might notice that your hearing's a bit down.
Yeah.
And we're fine because we understand about following someone even if we don't hear everything that they're saying. We're not learning new words. We can mitigate some of those things, and it's very short because we're bigger.
Yeah.
So because children have small anatomy, when they get this congestion behind their eardrum, it can last for sometimes days or weeks, sometimes weeks or months. And if you're the kind of child that annoyingly gets this repetitively, then your hearing keeps going down at various different points. And that's really difficult if you're trying to learn developmental skills, or you're trying to learn to read or spell or whatever anybody's expecting you to do.
Yeah.
So because glue ear affects children under the age of 6, 7, 8 the most, so under that age, then you've got that's a critical time for your development.
Yeah.
So that's a time when we need to really support children.
So how are children with a sensorineural loss, for example, would be on a pathway to get hearing aids? A child with glue ear, might not be that straightforward for them then.
Yeah, you're exactly right. So actually we do, for children with sensorineural hearing loss, there's a more direct pathway. And so that the importance of that is understood and services are built around that. But with children with glue ear, people are always waiting to see if it maybe clears up. And the guidance for the whole profession has been around giving it some time to see if it does clear up. And so between hearing tests, people often leave at least 3 months between hearing tests.
Okay.
So you do a hearing test, realise that the child's hearing has gone down because of glue ear, but wait 3 months before you do a second hearing test to see if it's there or not. And I sometimes think that if that carries on, and then the rest of the pathway, even if after that 3 months someone says, oh, you still can't hear very well, let's send you over to get to see somebody else, then you've got to wait to see somebody else, and then maybe you're considered for a grommet operation, but then you've got to wait for the grommet operation, or you've got to wait to be considered for hearing aids.
And all this time, the child is unable to hear properly, and that could be affecting. And how does that typically present in school? What happens when the child has to do it?
Yeah, exactly. I think that is exactly the point, is that period of time can build up quite quickly into sort of 9 to 12 months without people, even when people are trying to do their fastest work, because you're building in a kind of let's wait and see. And I think that if children couldn't see very well for 3, 6, 9, 12 months, we'd probably give them a set of glasses. But we're sending children into classrooms with difficulty hearing at times when they're learning not just speech and language and new words, but also the emotional content of words and how they're going to communicate socially. And something that people don't seem to know as much about is that children, when they're young, are developing listening skills. So children don't have the ability to listen like an adult can in background noise. So the listening skills are harder for them to develop. They get more cognitive fatigue around it, and that can be harder. So it can make it harder for children. And then I think actually all of these things I was worried about, but when I did research, the thing that I was most struck by is that it affects their emotional well-being. And I just hadn't known to look for that.
So when you say emotional well-being, I mean, what exactly are we saying here? That children are upset, or does it mean they might not develop appropriate emotional responses or be able to understand? What are you saying when we say that? What do you mean?
I think that I saw in some of the research that I was doing, almost half of the children were feeling like if they were in a situation where they couldn't hear as well as their peers, that anxiety starts to build up, particularly because children definitely do not want to be told off by anybody for not listening or not paying attention or or needing a break or looking out of the window because they just need to have a little bit of downtime for a second. And they're worried about being told off, or they're starting to develop their sense of self-worth and self-esteem. And I think that if they're starting to think they're not as clever as their classmates.
Which is interesting, isn't it? Because, one of the big effects of this actually, and think about all you've talked about, how much of it actually has to do with the ear is a part of it. But actually the sort of personal, social element of this is actually the bit that is where someone really might have to pay for it in the long run. So we're talking about life in Britain, and we've gone through this, and in Britain you can have conduction hearing aids. You could also have a grommet operation, which might go a long way to solving that problem.
It's great.
Obviously, for severe cases, you don't have so many of those. But it's not, even though the way you've described it, there's problems in this country with getting it treated and there's going to be knock-on effects. How is it different in the global south?
I think in the global south, we see it. So getting this type of congestion is worse if your nutrition isn't quite as good, if you are in overcrowded settings, if you're around smoke a lot, such as cooking smoke. So you've got children who are more likely to have blue ear, and then if you can't hear well at school, then they don't have the same setup, so everyone has to pay, even if it's a smaller amount for school. So you then start to not do well at school. And if your parents are having to pay it and they're trying to balance what they're doing with that money and your time, sometimes they'll pull the children out of school because that's not really working. But even if they do try to stay in school, they're less likely to pass exams. We know this from the research that's already been done. And then ultimately the biggest problem is that they won't get a job and they can't really see a way out of poverty. So that's probably the biggest impact, is that if you can't do well, if you can't access education, you start losing your future life chances.
Okay, so we're really talking about the big impact of this on a person's potential lifelong poverty.
Yes.
And the hardship that brings, obviously, is obviously real. So you clearly are passionate about this topic, and it's lovely to speak to people who care about what they do, especially in this field. And, you know, this is what CDA do, and we talk about deafness and hearing loss all the time. So it's great to talk to you about it. So what did you decide to do about it then? Because obviously you didn't let it sit with you for too long. You did something. And what was that?
I think I also had as if I needed just that extra little push, was that I have 5 kids and one of them got glue. And I think that I'd been thinking about it anyway, and I've been following what was happening to children, how long they were waiting for different interventions. And I think that once one of my children got glue ear, I also understood from the other side of the fence that actually there are some fabulous people who want to help these children, and we're keeping it quite a lot in the hospital. That if we maybe empowered all the adults that are around that child to support that child, that maybe we could do that in a different way.
Okay.
So it was very simple solutions that would, in the UK, might be able to support that child much earlier in the pathway while they're waiting. That wouldn't be too expensive. And that has been a bit of a journey. But to cut a very long story short, there's 2 things you need to do. One is you need to support children to hear earlier. So something that's reasonably cost effective. Most people are buying their child headphones. These work as headphones. They are essentially headphones that can be Bluetoothed into either a device or a microphone. They just happen to work well for children with glue ear particularly, but they are a set of headphones that anyone could wear really. But it was looking for an affordable intervention that could be early enough while they're waiting for their grommet operation or their full-blown hearing aid, or maybe they're not quite good candidates for either of those, and there might be something there.
Yeah.
Then, of course, what that means for children in, we focused initially on Malawi, was that we could support children to listen in the classroom, and it was it's pretty dramatic. I mean, the impact, because the very first girl that we gave it to, she realised that she could hear. She realised that she was actually very clever. Over 3 years, she had pulled herself up to being amongst her peers, so she must have a brain the size of a planet. And she's now studying nursing because what she wants to do is give back to other people who are in her position.
Brilliant. But before we go on too much, let's have a look at this.
Yeah.
Actually, I think we forgot to turn it off because and the battery's going to run out.
Oh, yeah.
Why don't you get out and kind of explain?
Well, this was because of some extraordinary support from Raspberry Pi, who helped in Cambridge as part of the social value thing. They just have been supportive all the way through. So this is something that's on their shelves for £50.
Okay, so you can buy it from a Raspberry Pi store.
You can.
For £50. So if you've got grandparents, you get a child in the family with blue ear, what a treat this is going to be.
Yeah.
A great present. So let's just explain what's going on with the way it looks.
So, yeah, it's a bit unusual, isn't it? But so you don't put it on like a set of headphones. It sits, this goes around the back of the neck, and then it hooks over your ears, and then that way it fits under a hat, and you don't have the hairband effect that some children don't like. So,
so you can see that then nicely in a shot. So it doesn't go over like that. They sit over the ears, around the back of the head. And then this is not over the ears. It's going to be sitting right in front of the ears. Why there?
Because the bone and the cartilage there conduct sound well directly to the cochlea. So they just bypass the eardrum, which is where the congestion is.
Okay, right. It's a bit like an earthquake around your cochlea.
Yes.
Really?
It kind of directs it in. Yeah, it's wonderful.
Beam of vibration.
Yes, yeah.
So do you mind if I put it on?
I'd love you to. That would be great, yeah. Okay. And then we have a little accessories box. So you might want to, if you had those as a set of headphones, you might want to connect them to your phone or computer or tablet, and then you might want to just hear clear some good speech and language enrichment activities, listen to a film. Audiobooks are great. It would help to do some enrichment activities with this particular type of headphone.
Waterproof?
Actually, splash-proof.
Splash-proof.
So far.
Can't take it.
Give me another few versions and we'll get it waterproof.
Okay, let's see if the mic works. So,
And then the teacher, you can instead, if you don't want to pair it to a computer or you're finished, you can turn that off. And then this little microphone comes in the box and then the teacher can just clip it on and the child can hear the teacher over background noise.
Yeah.
And supporting that listening skills and background noise is particularly helpful for children in classrooms. They don't have to wear it all day. They just, from a paediatric developmental point of view, I just want them to get, if they need their phonics lessons or they need their speech and language therapist or whatever it is to help their development, they can have that.
okay, so I'm going to explain what I can hear. So, it's quite a strange sensation. I've never experienced hearing in this way, but I can always hear you, especially if I push it down. I think it's probably my head shape or something. But when I do that and you speak, I can hear that so clearly. It's unbelievable. Now, I'm going to block my ears up so I don't get any sound in the traditional way through the ear canal. So my eardrums are going to be attenuated. They're not going to be receiving any sound, mimicking glue.
Mimics glue because they've got their sort of the problem with sound coming through just past their eardrums. But by putting your fingers in your ears, you have an idea of what it's like.
Yeah, so my ears are completely blocked.
Yeah, which is, and they're probably blocked to about the same. Putting your fingers in the ear gives you around a sort of 30, 40 decibel hearing loss, which is around what a child with glue ear would have.
Yeah, and I can hear you perfectly well to understand your speech, which I guess is the goal.
That's the goal. Yeah.
Just to understand speech.
Yes.
That works extraordinarily well. I mean, that's a great thing. So how did you go about, so just talk us through briefly the process of where you started and how you went through actually creating this and then how you ended up getting it to market?
Yeah, well, it has been a long journey. They say that it takes you about 10 years from your first idea to getting a product out, and it's taken me about 10 years. So, it's pretty true too.
10 years?
Yeah.
Wow, it's a labour of love, isn't it?
It is a labour of love.
Wow.
But it involved... It involved me having to change my mindset in lots of different ways. And I think that I've now become involved within a program called the NHS Clinical Entrepreneur Program, which is a program which supports NHS workers who have an idea to improve patient care. And actually now I'm in a position where I can support other people to bring ideas out, like specifically for NHS patients. But of course, if you're trying to make things affordable or quicker or more efficient, then of course that's helpful to other NHS, for other health services abroad. And so for me, the Global South has become an area for me as well. But the aim is to help both places.
Home and away.
Yeah, and so this is about the third set of headphones.
Is it?
And if I hadn't have had that support from Raspberry Pi, who just understood the kind of the social value and the aims and the mission, I don't think I'd have got it out here. So it was definitely the Cambridge ecosystem. And they also, because of their enormous generosity to make it possible, it encouraged other people to be generous. So we were able to do it with very little funding and make something that was available for people. And it sits really as an assistive technology because actually anyone can use these headphones if they wanted to use them.
Yeah.
You see some people running with this type of headphone, don't you?
Or swimming.
Yeah, or swimming, exactly, because then they still got that. Because if your ears are still working okay, you can keep your ears open for traffic noises and still pair this to your phone. Yeah. So it can be used by people with good hearing or difficulties with their eardrums.
So it does have a lot more potential beyond, I guess, the intention of why you made it, which is probably what happens to the best inventions, isn't it? Much more popular. So what's going to happen? Sorry, you were going to say something.
No, I was just going to say in the Global South, they have a lot of children with discharging ears where their eardrums are broken down from lots of infections and they can get chronically discharging ears. And so the good thing about this hooking over your ears is that discharge can still come out. So you know how you have to take hearing aids out, for example, because you can't wear them if you've got very sore ears or a lot of discharge. This hooks over the front so any discharge can come out. So it's helpful.
So another benefit of the way you do it. So what's going to happen next with this invention? Where are we going to see it? Is it going to get to the global south? Is it going to get mass produced? How's it going to work?
Yeah, we're just at the point where this is a great time because we've done lots of research. We've been able to show that this improves hearing for children with glue ears. We've been able to verify the app. The app has also been taken in-house into the Royal College of Paediatrics. And so it's just at a point, I think, where we've created enough. It's won a few awards, so it's got reassurance around it that it's okay to use for people and that people understand it. And so now we're doing pilots in different NHS trusts and abroad. And so now we have some companies who are interested in potentially taking it further. And also Raspberry Pi continuing to keep it really affordable in their stores at the moment.
Amazing. And so what's the future for it in the global south? How is it going to get to enough kids, to have that fulfilled? And then I guess in Britain, when can we start seeing it? I mean, I know it obviously has to be mass produced first. That's the first step, is it getting mass produced? But once that's done, how are we going to get enough in?
Yeah. So in Britain, people can currently buy it, but it's up to them to buy it. Right. There's some interest in potentially being able to loan it out, rent it out, and we're having discussions about whether it could be built into the NHS as an initial support technology before you have anything else, and see if that does the job. And that might help relieve some of the burden of the pathway.
Well, that would address the problem that you mentioned at the start, which is about those gaps in between the first assessment, the second assessment, the operation. That if this was around then and it was provided, then that would kind of address that initial kind of purpose, wouldn't it?
Exactly. And one of the things that we saw was that if parents then knew how to manage their child's glue ear, but it did clear up after 3 or 4 months, if it came back the following winter, then they knew what to do again. So they could support their child, even if their child didn't need to go on and have grommet operation, for example. So, and I think so it's available for people in the UK to buy. And then in Malawi, it looks like there are people who are quite interested in supporting it, because actually if you look at all of the children who have a hearing loss, this is the most common type of hearing loss for children, this particular type of hearing loss. But if you take all of the children globally who've got hearing loss, only 20% are wearing anything to support their hearing. So 80% of children globally have nothing. So it doesn't matter. I don't really mind if they're using this or they're using anything else, but that's something that is really inequitable. It's something that the World Health Organization is completely focused on, because it's a priority area for them. If you get those children hearing, or support them in whatever way you want to support them, so that they can access education, then they can access work, then they can support their families. So, and actually the World Health Organization is saying to any country, if you support people with hearing loss well, we're all going to get some hearing loss at some point. So if you just do that well, you will help people access work better. It will be better for the economy in every country.
Absolutely. That's been a fascinating journey from start to finish about this invention and your history and your passion for it. Really enlightening, and I think we're so lucky to have you in Cambridge. So is there anything that people watching this at home can do? Is there a way they can support the project?
Amazing. We have the Hear Glue Ear app at the moment. I want to put some updates onto it now, but it's free at the moment. We've tried to keep it free with charity partnerships. So anyone who's got a child with glue ear, it just has some very simple activities on it for the child and some information for the parents. And we've got lots of ideas about how that could be better. So hopefully in the future you'll see that improving as we get more and more funding, I hope. And then you can look up hearglueear.co.uk, and that will give you more information.
Brilliant. Well, Doctor, thank you so much for your time today, coming to our base here in Cambridge to tell us all about that invention. Wish you all the best. Can't wait to see it in the shops. And if there's anything more we can do, of course, then just let us know.
Well, thank you. Thanks.
Well, I hope you enjoyed that whistle-stop tour through this amazing Cambridge invention, which is set to potentially help children all around the world with their glue ear. Thanks for watching.